of the United States and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Mr. Mapes, would you lead us, please?
Well, we thank you for this day. We thank you for safe travel for those of us who travel distances, and just bless this time that we have together. Give us the wisdom, we pray, in any decisions that we make. We ask it in Jesus' name. Amen.
Amen. All right, good morning. Welcome to all of the new commissioners. Now can we have a roll call, please?
Commissioner Van Osten,
Here.
Commissioner Hankins,
Here.
Commissioner Linjon, here. Commissioner Coons,
Here.
Commissioner Hellek,
Here.
Commissioner Turnbull,
Good morning. Here.
good morning. Commissioner Mapes,
Here.
Commissioner Chamberlain.
Here. Get caught up here on my pad, so just give me a moment, if you would, please. Okay, take a motion to approve the agenda. I'll make a motion to approve. Motion, is there a second?
I'll say.
Second, roll call vote there, please.
Commissioner Chamberlain,
Yes.
Commissioner Coons,
Yes.
Commissioner Hellek,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Van Osten,
Yes.
Commissioner Mapes,
Yes.
Commissioner Hankins,
Yes.
Commissioner Wingo. Yes. Motion carried.
I remember one of the questions I was going to ask. Board, on your agenda, item number 13 is the election of chair and vice chair. And I may have had a brain cramp here, but I was thinking that we perhaps need to move that. I mean, I don't mind proceeding as
Yes.
we are.
You're correct, that you should,
We
I
should
didn't,
move it.
I just realized, just as you said that, this
Yeah.
should be the next step should be a new chair, because there's no chair right now.
Okay, so. I don't think we've called the roll yet on the approval of the agenda, have we? We
Yeah,
did.
but you can move stuff around
Okay,
without doing.
so
anything.
Chair, Chair. Before we move forward, ladies and gentlemen, this is our organizational meeting as well as our regular Board of Health meeting. So I'm going to ask that we move to item number 13 for the organizational meeting to take place before we proceed any further with the agenda.
I'll make a motion that we appoint or elect, Scott Hankins as chair.
I'll second that.
Okay, thank you. Are there any other nominations? Hearing none, can we have a roll call there, please, Mel?
Commissioner Mapes,
Yes.
Commissioner Hellek,
Yes.
Commissioner Wingo, abstain.
That's why.
I'm sorry.
No, that's okay, that's why. You don't know me.
No. Commissioner Coons,
Yes.
Commissioner Hankins,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Van Osten.
Yes.
Motion carried.
All right, even without Ms. Wingo's support. Next, we need a vice chair.
I nominate Terry Van Alstyne for vice chair.
I'll support. Move to second. Are there any further nominations? Hearing none, can we have a roll call vote there, please, Mike?
Commissioner Coons,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Van Osten,
Yes.
Commissioner Mapes,
Yes.
Commissioner Hellek,
Yes.
Commissioner Hankins,
Yes.
Commissioner Wingo, abstain. Commissioner Chamberlain,
Yes.
motion carried.
Okay. Good, thanks for letting us get that taken care of and out of the way. I think since we're on item number 13, let's go ahead and take care of committee assignments and meeting times and dates, locations, et cetera. Program and Evaluation Committee. Josh, I believe you said on that.
Yeah, I'll be
Okay.
chair of that.
Okay, so who is,
So we got Don Mapes, Jonathan Turnbull, and
And Terry, isn't it?
Okay,
Yep.
okay. I would, I'm a big believer, unless there's a problem, let's don't fix it. I think you carry on a lot of, historical knowledge if you maintain that consistency, so I wouldn't want to change that, that committee, as long as that's acceptable with everybody. And I'm just looking for consensus,
Yeah.
if we're all good,
Yeah.
okay? Which then the Personnel and Finance Committee would be, myself, Ms. Wingo, Mr. Coontz, and Mr. Helwig. So, those are, I believe, as chair, that, falls up to my responsibility to make those assignments. So, unless there's any disagreement on the board, and I'd be happy to air those out now. We all good? Okay. 2025 meeting times and dates. Normally, we are not here on the, is this the second or the third Wednesday? I am lost. Normally, we're not here on the third Wednesday. Normally, we meet on the second Tuesday at 10 a.m., either here or in the Shirley Roloff Center.
First Tuesday.
Thank you. No, the second Tuesday in transportation.
Yeah.
First Tuesday.
First Tuesday, see, this is why we have you guys, to keep me
I'll
on
make a
track.
motion, I'll make a motion that we leave our meetings the first Tuesday of the month at 10 a.m. at the Shirley Roloff Center.
I would have, oh, I'm sorry, I didn't have a second.
I'll second. Discussion.
I would have one request that on September of 25, maybe we go to the second Tuesday or the first Wednesday.
In September.
Wednesday,
I have building and grounds.
So possibly the 9th of September, maybe instead of the second.
Okay, we can, when we get to, and I understand this is an appropriate time to make that recommendation. I would ask that when we get to August, if you can remake that motion, because I don't know where everybody else's,
Right,
committee assignments are gonna fall for their own counties.
right.
So if that's something we can address,
Why would we not put it in there now, so when they are go to their committee assignments, they know they're at that meeting? I mean, if we're setting meetings for the year, why would we not set the meeting now?
okay? Let me grab my calendar here. So you are proposing,
September 9th.
Yeah,
I'm good with that.
That would be, we can't
We
do that.
can't,
so you
that's
can't
our
do it.
board meeting.
normal board meeting, okay. All right, with the 4th, September 4th work?
Our board meeting,
Usually like for, I know a lot of us don't have stuff going on Fridays, a lot of us.
You
That
have
would be-
stuff going on
No, we
Friday?
don't, I've noticed a lot of commissioners, Mondays and Fridays.
Okay, would anybody be willing to consider Friday the 5th?
Yeah, I'm open on that, so.
Thank you.
okay, yeah, okay, still at 10 a.m. at the roll-up center, okay. All right, so with the exception of September the 5th, we'll maintain our first Tuesday meetings at 10 a.m. either here at the health department or at the Shirley Roll-Up Center, which is on the north side of Charlotte here. We had a motion and a second. Is there any further discussion? Hearing none, can we have a roll call, please?
Commissioner Higgins,
Yes.
Commissioner Coons,
Yes.
Commissioner Vanowski,
yes.
Commissioner Reeves,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Howard,
Yes.
Commissioner Linville. Yes. Motion carried.
All right. Look at this, getting stuff done. Let's flip back then, and for a lot of you, you weren't present for a number of these meetings. We had a bunch of meetings in December. So, can we address these all with one motion, or do you want to go individually?
I think Roberts is individually.
Okay, that's fine.
And the board as a whole can vote on them because it's a snapshot in time. If they can abstain or they can vote on it either way because it's just a snapshot in time of what happened.
Right.
I'll make a motion to approve the meeting minutes from December 3rd, regular meeting.
I'll support.
Moving to second, any further discussion? So we have roll call, please.
Commissioner Helley,
Yeah. Yes.
Commissioner Coons,
Having not participated in the meeting, I think it's more appropriate for me to abstain.
Commissioner Hankins,
Yes.
Commissioner Wingo, abstain. Commissioner Mapes.
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Chamberlain,
Yes.
motion carried.
Okay. Review, excuse me, review and approval of the special meeting minutes. Did we have a second one on December 3rd?
Uh-huh.
Okay. Anyone would like to make that motion? Item number 6. Moved by Josh, I'll second. Any further discussion? Roll call, please.
Commissioner Mapes,
Yes.
Commissioner Hankins,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Wingo, abstain. Commissioner Helley,
Oh, I'll say.
Commissioner Coons,
Abstain.
motion carried.
Item number 7, review and approval of the special meeting minutes from December 9th, 2024.
I'll make the motion to approve.
I'll second.
Moved and second, any further discussion? Roll call, please.
Commissioner Wingo, abstain. Commissioner Coons,
Abstain.
Commissioner Hankins,
Yes.
Commissioner Helley,
Abstain.
Commissioner Mapes,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Turnbull,
Yes.
motion carried.
Item number 8, review and approval of the special meeting minutes from December 16, 2024.
I'll make that motion.
I'll second.
Moved and seconded, any further discussion? Roll call, please.
Commissioner Van Alstine,
Yes.
Commissioner Wingo, abstain. Commissioner Helley,
Abstain.
Commissioner Mapes,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Coons,
Abstain.
Commissioner Hankins,
Yes.
motion carried.
Review, item number 9, review and approval of the special subcommittee meeting minutes from December 19th of 2024. I'll make the motion that we approve.
I'll second.
Moved and seconded, any further discussion?
Was was that the second?
Yes.
meeting? Okay.
Yes,
This is the following.
correct. Moved and seconded, any further discussion? Roll call, please.
Commissioner Chamberlain,
Yes.
Commissioner Mapes,
Yes.
Commissioner Hankins,
Yes.
Commissioner Coons,
Yeah, abstain.
Commissioner Turnbull,
Yes.
Commissioner Helley,
Abstain.
Commissioner Wingo, abstain. Commissioner Van Alstine,
Yes.
motion carried.
Item number 10, review and approval of the special meeting minutes from December 20 of 2024.
I'll make the motion to approve.
Second, moved and seconded, any further discussion? Roll call, please.
Commissioner Van Alstine,
Yes.
Commissioner Hankins,
Yes.
Commissioner Wingo, abstain. Commissioner Coons,
Abstain.
Commissioner Helley,
Abstain.
Commissioner Turnbull,
Yes.
Commissioner Mapes,
Yes.
Commissioner Chamberlain,
Yes.
motion carried.
All right. That was item number 11, correct?
10.
10, item number 11, review and approval of the special meeting minutes from December 27.
I'll make that motion. I'll make that motion.
I'll support.
Moved and seconded, any further discussion? Roll call, please.
Commissioner Coons,
Abstain.
Commissioner Van Alstine,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Mapes,
Yes.
Commissioner Wingo, abstain. Commissioner Helley,
Abstain.
Commissioner Hankins,
Yes.
motion carried.
All right. That moves us to item number 12, ladies and gentlemen, which is public comment. We would ask you to step to the podium, state your name and where you reside. You'll have 3 minutes to address the Board of Health. I won't start until you have stated your name, and I'll give you the friendly 30-second warning that your time is about to expire. Would anyone like to address the Board of Health?
What question, is the Zoom on, or, because all I'm seeing is a beautiful screen, so I don't know.
I believe the Zoom is on here. We have, yes.
Okay, good,
Okay.
just double check it, thanks.
Okay. You didn't state your name, did you?
You beat me on.
Thank you.
The voters.
That's fine. Not a problem. Thank you. Would anyone else like to address the Board of Health? Okay, hearing none, public comment is now closed. We've already taken care of item number 13, moves us to item number 14, staff reports. Holly, somebody else gets to talk.
Great, thank you. Good morning, everyone. Again, I want to welcome the new commissioners. We're really excited to work with you all and welcoming back Mr. Coons as well. So, yeah, we're definitely happy to have you. My report, I'll keep it really brief. I did a strategic planning update, and our strategic plan goes in a 3-year cycle. So we have just completed our 23, 24, 20, excuse me, our 22, 23, 24, and now we're moving into our 25 to 27 cycle. Before I start there, we will be doing a board orientation if you know, Dana and Commissioner Hellwig, if you want to participate, everyone is welcome to participate. We'll probably bring that next month, and we'll do more of an in-depth overview of the health department, the history, you know, our active initiatives, what we're mandated to do, some of those type things. So we can really get into the nitty-gritty. I did hand out the Michigan Public Health Guide for Governing Entities. So if you didn't get one of these and you are a returning commissioner, let me know. I have a few extra copies here. Okay, so this is a hard copy. I think that last year they had done an electronic version, and then they did end up getting those bound. So can pass those out. But one of the, you know, our core values and our fundamentals here at the Health Department in Northwest is that we celebrate success. And I'm sure like many of you in your commission jobs or in your, you know, your day-to-day job is celebrating success often comes as an afterthought. But I like to try to encourage people through the things that we have done and what we can be proud of. And I just wanted to go through quickly and highlight that we did pass our Michigan Local Public Health Accreditation in 2024, which was, you know, always a relief, and glad that that's done. We revamped our internal newsletter. You know, we continue to develop training and education. The beauty of public health in our agency is we have so many different professionals and backgrounds that usually we have an expert on staff that can come up with whatever we're needing. So we're always working on communication and enhancing that, not only between, you know, the staff and the Board of Health members, but also, you know, internally, and then with our external community partners as well. And as always, we're working on professional development of our workforce, retaining that workforce. That's really important to us. And making sure that we're investing in them, that they feel valued and that they're happy with their jobs so that we can keep them at our agency. So as I mentioned, we just, in the last several months have completed our new strategic plan. We do these through some facilitated discussions and this pretty specific process. And it's, you know, all the leadership team here, supervisors, some employee representatives from each division, and then we add in some other focus areas to kind of round out that. So we're getting a really good representation of what the needs are and what the agency as a whole wants to address. The 3 directions for these upcoming years are implementing agency processes and structures. So just getting really rock solid on that. Since the pandemic, there's been some things that have just gotten away, right? And we need to update those and review them and make sure that we're following those. Building, retaining, and supporting a strong workforce. Again, that's a major focus. And then really sharing our story, you know, whether that's with you all at the Board of Health or at your county commission meetings, through our annual report, through different media outlets, social media, all of those type of things. Historically, public health has been silent, and we have not been in the last several years, as you all well know. And so sharing our story in a great light to really keep building our public trust is important to us. So as you can see, there's some examples of what we'll accomplish in the next coming years. And one of the main ones that I want to highlight is just refreshing that Board of Health orientation. So there was a pretty comprehensive one last year and the year before, and then we'll revisit that. And it's always good. I think you learn something new every time. So one last thing is just that the statewide sanitary code didn't move in the last session. I'm sure most of you know that. So as we enter into a new legislative year and sessions, that the sponsors probably will reintroduce that. So we'll be keeping a close eye on that. And I think that that's all I know.
Okay,
Thank
does
you.
anybody have any questions for Holly?
I have one.
Go ahead.
Will you still be doing, I noticed you still have 9 and 10, will you still be doing the little?
The Wellness Wednesdays?
Yeah. I
Yes.
think Melissa was on it last one. It was.
Yeah, actually, they're heading down next Wednesday to
Okay.
do another filming. So for those of you that don't know, we go to 9 and 10 News in Cadillac and we do a Wellness Wednesday where we, talk about different public health issues or health issues, and then it's aired on those Wednesdays. And it's just been something really fun and
I think it's great.
get us out there and share good stuff. So, yep, we'll continue that. Thank you.
Good. Any other questions for Ms. Campbell? Okay. Thank you, Holly. Any questions for any of our directors who are present regarding their written reports? Mr. Ben Austin.
Hey, Jeremy, on your report there, you have the, radon stuff. Do you know what the, how many people have had that tested that's in our district and how much radon, how many of them come back positive for radon? Just a guess.
I don't know if I can guess on that, Terry. There's a list that comes out at the end of January, and I can give you that.
Okay, yeah, that'd be great. Can you forward that to us?
Yeah.
Great,
Yeah.
that's all I got.
Yeah.
Thanks. Thanks, Jeremy.
Yeah, no problem.
Any other questions?
I have one for Jeremy too about this. My question is, have they ever looked at, is certain soil types differ or the amount of radon that's in it?
It can, it really is about if the soil or the geology actually, it entraps the gas, that's more what happens. And then if that cracks, that can leach out into the house, like the basements and things like that. So soil does play a role in it, because it depends on like how compact the soil is, how,
That's what I was
where the
looking
gas comes. in.
Looking at the maps, I know like Kalkaska, these areas are more sandy and they're lower numbers.
Yeah, so it probably evaporates faster, is the
Okay.
assumption.
Thank you.
Yeah, no problem.
Anything else for any of our directors? Jeremy, I'm gonna ask you something that's not in your report.
Okay.
It's been a while since we've had any type of update on the PFAS situation, around the Emmett County Airport.
Okay.
Is there anything that pops up off the top of your head? Are we still providing bottled water to the,
Oh, no,
okay,
we haven't been providing bottled water in over 2 years now.
okay,
What we do is, we give filters every 6 months to residents that have a positive PFAS sample. So,
okay.
As far as what's going on, I believe Don and, Matt may know too, they're actually doing, they're testing wells, near a school area, for possible municipal water in the future. They also are doing some remediation, testing to see if they could actually slow down the plume movement. So that's kind of where we're at right now. Kind of feasibility studies for the village for municipal source.
Okay, I just knew it'd been some time since we had talked about it, but
Yeah,
at one time it was a pretty hot topic.
Scott, I would say we're looking at years still until that happens. So we'll be doing filters for a while.
Okay,
They are going to start, at the state level, the Department of Toxicology is going to start doing blood draws on people that have been affected by this, and they're gonna start a longitudinal study to draw and, you know, start tracing PFAS if it's tied to health related effects and things like that, kind of like they did with PBB and continue to do so,
Okay,
that's one thing to do.
good, thank you. Any other questions, from the Board of Health for any of our directors, regarding? Sir, go ahead.
I have a question for Dr. Meyerson. He's still present, I mean.
Yeah.
Related to your report, and I apologize for that, but people, in my area have been asking me regarding the four, more or less, problems that you've mentioned over the last couple of months, 3 mosquito related, the West Nile virus, the, Eastern equine encephalitis and bird flu. And the 4th one was whooping cough. Have there been any further developments on that, or, I mean, I figured the first 3, I want to hear from you before I just make assumptions, but the first 3 being mosquito borne, I think your report said would be kind of off the table now, seeing that, you know, it's winter and mosquitoes are dead, ha ha. Poor mosquitoes. I don't know. But even though you mentioned whooping cough, cases over in Traverse City, have there been, have these things been spreading, or, do you have an update on that, sir?
Yeah, sure. You know, you're correct, the kind of, you know, environmental, the, vector-borne diseases, mosquito-borne or tick-borne. We had, you know, we were having reports of, infected wildlife, and individuals, you know, even in October, November, because it was a mild fall there. But I would not expect too many more of that, given the time of year. We've kind of moved into the respiratory season. Whooping cough, last year was, the most number of cases statewide, that we've seen in probably, I think, over in like 10 years. I think it's reached about 1,000, near 1,000, or even over 1,000 statewide. We had several cases here in our jurisdiction. We've not had any reports of it in the last month. Does that seem about right?
Yeah, I would say about a month.
About a month.
I've seen that.
So I think it's quieted down, but whooping cough is, you know, caused by pertussis. It's a bacteria. It's transmitted from person to person, and it really, it lives in humans, so it's out there. Hopefully, we've kind of quieted down the outbreaks, but we certainly could have more cases reported. I hope not, but that's something that's always a potential there, especially, while school's going on and we're spending more time indoors. And then the other thing, this is, we're starting to see a big increase in cases of the respiratory viruses, COVID, RSV, and influenza. Lots and lots of influenza starting to come in now, which is January. Yeah, pretty typical. People were all together and mingling during the holidays, and now we're back at work and school, and I'm sharing those things that we shared with our family. So
Thank you.
cover your cough and wash your hands, and stay up to date with your vaccines. And, if you're not feeling well, stay home. That's really our message.
Okay, thank you.
You're welcome.
All right, before we move on, is there any further questions for any of our directors? Okay, hearing none, we will move to committee reports, Personnel and Finance Committee. We had November bill pay. Did we not address this in December?
We just did the December bills at the bill pay meeting before this.
Right.
The previous bill pay meeting, they approved November bills, but now we need to come before the full board.
Got it. Thank you. Okay. So, I'm going to make a motion that the Finance Committee met to review the bills and employee expenses. And we'll make that motion to the full board to approve the November 2024 bills in the amount of $741,685.16, and the November 2024 employee expenses of $20,983.19.
I'll second it.
Moved and seconded. Any further discussion? Roll call, please.
Commissioner Higgins,
Yes.
Commissioner Coons,
Yes.
Commissioner Lingo, abstain.
Commissioner Helley, Commissioner Turnbull,
Yes.
Commissioner Mapes,
Yes.
Commissioner Vanowski,
Yes.
Commissioner Chamberlain.
Yes.
Motion carried.
Thank you. That only works at month, you know.
I know.
Okay.
That's not, that's not.
Program and Evaluation Committee. Mr. Chamberlain,
We did not hold a meeting,
okay,
nothing to report.
okay. That moves us to item number 16, unfinished business, we have none. Item number 17, new business, the health officer contract. I can report that I did meet with Ms. Klanowski. We came to an agreement on the contract, which was within the parameters that, the previous Board of Health set for me. And, prior to making an official, appointment to that position, we're still in the process of waiting for the state credentialing, which, takes upwards of about 3 weeks. So I would think that, hopefully we will hear before our next meeting. And we can make the formal appointment at that time. Does anyone have any questions regarding that? Okay. Here now we'll move on to item number 18, public comment. Ladies and gentlemen, same rules. You would step to the podium, state your name and where you reside. We'll give you 3 minutes to address the board. I'll give you the friendly 30-second warning that your time is about to expire. Would anyone like to address the Board of Health this time? Okay, public comment, hearing none, we will close public comment. Commissioner comments, Mr. Howard.
Just, like to say, I look forward to learning from everybody and, being a positive factor on the health board, so.
Very good, thank you, welcome. I will tell you, and Mr. Coots already knows this, but this one is just like getting a second board commission spot. There is a ton to learn. It's like drinking from a fire hose. Don't worry that you don't have a full working knowledge of the entire health department by next meeting. By March, we expect something. No, that's a joke.
Next year.
Next year.
Or 2 years.
Yeah, this is my beginning of my 5th year and I still don't know everything.
Not our job.
Yeah, that's true. That's why you were hired.
That's why you leave professionals to do professionals and you leave policy and budget to us.
Always a source of wisdom. Thank you. Mr. Van Alstine, do you have anything?
I have
further to add?
nothing, sir.
All right, Mr. Mapes. Okay, Mr. Coots.
I passed. Thank you.
Okay, welcome back.
Thank you.
Mr. Chamberlain,
I'm good today.
Ms. Wingo.
Well, I just want to say hi, everybody. I think this was the warmest reception I've ever received on a committee. And I appreciate that. A little bit about myself as far as your format here is very familiar to me because I was on the North Country Community Mental Health Board. So I am familiar with state mandates and the budget and finance. So, and I just want to say it's a pleasure to be able to represent Exeter County.
Great. Jonathan really likes LP's tacos. I don't know if he shared
Yeah,
that.
he did. He did.
Everybody knows that.
If not, I do now.
And Melody's.
Yes.
Yeah.
Yeah, that's what he was telling me.
Mr. Turnbull, do you have anything further to add?
I just wanna, tell everybody that I'm really glad to be back, back here. I Michigan, I spent the weekend down in Florida and it was weird, it was freezing, but I am glad to be back in Michigan, we missed the snow. I did want to encourage everybody just to remember our service members that are serving overseas. Tomorrow is a really important day for me, seeing that it marks the 6-year anniversary of the explosion that I was in. So I do ask everybody, the public, I mean, commissioners here present, remember why we do what we do. You know, continuing the defense of freedom, you know, protecting the American way of life and promoting justice in all things. But in your prayers and thoughts, please keep in mind of all those that have served our country, those that, you know, family members that are still here, that have lost their loved ones. As I mentioned, in the past, that 4 service members that died alongside me. So it's gonna be an emotional week for me. Apologize for bringing in such a heavy topic, but that's my life. So I just want to say I'm glad, I thank God that I'm still around. And it's been 6 years and the relationships I've developed and that he's given me the opportunity to continue to serve our country, to, serve the Constitution. And I'm glad to be here. So thank you, guys.
Thank you, Mr. Turnbull. We appreciate you, Jonathan. That concludes our agenda, ladies and gentlemen. I'll take a motion to adjourn.
So move.
Is there a second?
I'll second.
Move to second, all in favor, say aye.
Aye.
Any opposed? Thank you.